To begin, I would like to give a little background on who Jehovah's Witnesses are. They actually began back in the late 1800s in Pennsylvania with a small group called the Bible Students, which was originally led by Charles Taze Russell. After Russell passed away, Joseph R. Rutherford became the next leader, and under his direction, the group officially took the name Jehovah's Witnesses in 1931. What really stands out about this faith is how devoted they are to living by the Bible. Everything from their ministry work to their everyday choices is centered around Scripture. Understanding its history helps us as nurses because their beliefs, especially about refusing blood transfusions, aren't random or stubborn. They come from a deeply spiritual place. Knowing that helps us approach their care with empathy and cultural respect. One of the most well-known beliefs of Jehovah's Witnesses is their refusal to accept blood transfusions. Their belief comes from a Bible verse in the book of Acts, chapter 15, verse 28 and 29, which tells followers to keep abstaining from blood. For witnesses, this isn't just a medical choice. It's a spiritual command that's deeply tied to their relationship with God. They believe that accepting blood will go against their faith and could even affect their standing within the religious community. As nurses, this is where a big ethical challenge comes in, because we're taught to do everything we can to save lives, but we also have to respect the patient's autonomy and their spiritual values. It's a good reminder that nursing isn't just about treating a disease. It's about understanding the whole person and providing care that honors who they are. So even though Jehovah's Witnesses don't accept blood transfusions, many of them are open to other options that still respect their beliefs. For example, they might be okay with receiving IV fluids like saline or lactate ringers to replace lost fluids. Some also may accept special solutions called colloids that help maintain blood volume. There are also bloodless surgery techniques that focus on preventing blood loss, like using careful surgical methods or equipment that recycles the patient's own blood as long as it stays connected to their body. And then there are other options such as medications like erythropoietin, which helps make blood cells, and iron supplements to raise hemoglobin levels. As nurses, knowing these options help us provide safe care that also respects our patients' faith and choices. When it comes to blood transfusions, Jehovah's Witnesses can bring up some tough ethical situations for healthcare workers. For adults, if they're alert and capable of making their own decisions, they have the legal right to refuse blood products, even if it could cost them their life. As nurses, we have to respect their choice, which follows the ethical principle of autonomy, or the right to make their own healthcare decisions. But things get more complicated with children. Parents might refuse blood transfusions for their kids based on their faith, but it's the child. So as nurses, our role is to respect the family's beliefs while still advocating for the child's well-being and following ethical and legal guidelines.
When caring for someone who is a Jehovah's Witness, nurses must take specific concepts into consideration. While it is well known to many that Jehovah's Witnesses cannot accept blood products due to their beliefs, it is not well known to many how to handle such situations when the need for blood product arises in someone who is a Jehovah's Witness. There are a few options to consider when working with a Jehovah's Witness. First, they should be asked if they are willing to accept blood products. Of course, only if they are deemed capable of decision-making capacity and are at an alert level of consciousness. If they cannot speak for themselves and have paperwork showing they cannot receive blood products, the next decision is what can be used instead. Often the paperwork that many Jehovah's Witnesses carry with them indicates what they will and will not accept due to their spiritual beliefs. Bloodless surgeries are becoming more commonplace, although they are still difficult to perform. Another option are blood substitutes, such as bioartificial oxygen carriers, hemoglobin transfusions, and synthetic emulsions, all of which either stimulate red blood cell production in the body or replace some of the oxygen carrying capacity of the remaining red blood cells left in the body. Transfusions of whole red blood cells are not permissible for practicing Jehovah's Witnesses. Many of the alternative options have been mentioned already or will be described later in this presentation. So basically, nurses should be checking for paperwork stating what a Jehovah's Witness will and will not accept. According to Mignet and Brain, many Jehovah's Witnesses will carry a card in their wallets detailing what they can and cannot accept when it comes to medical care. ED staff should be checking unconscious patients for this paperwork and should inform the entire care team if it is found. Staff on inpatient units should be informed as well when they receive a patient who is a Jehovah's Witness. When caring So basically, nurses should be checking for paperwork stating what a Jehovah's Witness will and will not accept. According to Mignet and Brain, many Jehovah's Witnesses will carry a card in their wallets detailing what they can and cannot accept when it comes to medical care. ED staff should be checking unconscious patients for this paperwork and should inform the entire care team if it is found. Staff on inpatient units should be informed as well when they receive a patient who is a Jehovah's Witness.
The following case study is about a 16-year-old girl diagnosed with acute myeloid leukemia. The patient initially refused blood transfusions mainly because of her religious status. However, medical professionals determined that she was no longer able to make an informed decision about her care because of outside influences distorting the truth about her condition. This was made evident by the patient's belief that she would not die if not given the transfusions. Under the duty to protect children, the patient was physically and chemically restrained and forced to receive 38 blood transfusions. The patient, often under extreme psychological stress from the trauma of receiving the transfusions despite her continuous refusal, succumbed to her condition, and her surviving family later sued the hospital for violating her rights to refuse and subjecting her to trauma. The judges later ruled in favor of the hospital after determining that Orthodox adherents and religious advisors contradicted the statements made by medical personnel, leading the patient to a false sense of security about her diagnosis. The decision to override her autonomy was made based on the factors of competence, accurate information, and freedom of coercion. Since she was not given accurate information and appeared to be coerced, The medical professionals went ahead with the transfusions. The second presented case study is a case where alternative therapy was available but not accessible until too late. The patient was a 46-year-old woman with a large left-sided intraparenchymal hematoma in her brain that required emergency surgery. From the time the patient was admitted to the hospital, her level of consciousness significantly decreased to a state where she could no longer give informed consent. Her parents stated that she was a Jehovah's Witness and refused all blood transfusions and products on her behalf. The issue with this was that the patient had no advance directives on file and no medical card indicating her religion and refusal of transfusions. Medical professionals debated whether to override the patient's autonomy in the name of performing life-saving measures. They were concerned of the possibility of being criminally charged with battery and sued for malpractice if they went ahead with the blood transfusions. Hospital administration was brought in to help decide the best course of action. After more than 2 hours of deliberation, the emergency surgery was conducted using synthetic substitutes as a replacement for blood derivatives. However, despite the successful surgery, the patient's condition did not improve, and she was later extubated and passed away in a week post-operation. The prolonged deliberation that delayed her life-saving surgery was questioned ethically, as it was a preventable increase in the mortality risk for the patient.
Understanding the person. Jehovah's Witnesses do not accept blood transfusions because they believe the Bible commands them to avoid taking in blood. They view blood as sacred and believe that accepting transfusions goes against God's laws, even in life-threatening situations. They choose medical treatments that do not involve blood. Nurses should have a basic understanding of this belief because it helps to build trust, promotes respect, rapport, communication, and supports holistic care. Approaching the framework for care. Currently, there are approximately 1.3 million Jehovah's Witnesses members in the United States. One of the most well-known aspects of their faith is the religious refusal of blood transfusions based on their interpretation of biblical scripture. As a nurse, it is important to understand and respect these beliefs when planning and delivering care, especially in situations where blood loss or transfusions may be involved. Providing care to a Jehovah's Witness patient requires not only clinical knowledge, but also cultural competency. When we assess our patients, it begins with getting to know them beyond their medical condition. As a Marquette nurse, we are holistic providers. Understanding the spiritual and or religious needs of our patients is key in preventing fragmented care and delivering patient care that reflects respect and advocacy. Many individuals are aware that Jehovah's Witnesses members do not give or receive blood transfusions, but how do nurses make consideration for this in the context of patient care? Creating the framework for care. Assessment, diagnosis, planning, implementation, and evaluation. Upon the completion of the general survey and prior to the physical assessment, the nurse should conduct an interview with the patient to understand their activities of daily living, nutritional intake, psychosocial needs, medical history, treatment preferences, and spiritual beliefs. This interview gives the opportunity for the nurse to understand who the patient is as a person, as opposed to just their symptoms. With the discovery that the patient is Jehovah's Witness, the nurse should then assess for any blood disorders. In the event that a blood transfusion is needed, the nurse should know the patient's feelings and preferences to blood products such as plasma-derived blood fractions like albumin and clotting factors, non-blood alternatives like erythropoietin or EPO, blood expanders, and salvaging techniques. This establishes autonomy and justice between you and the patient. Based on the assessment, the nurse should then identify a nursing diagnosis that is supported by evidence. When planning care, the nurse should focus on goals that honor the patient's values and ensure safety. The nurse should also collaborate with a healthcare team and possibly even the Jehovah's Witness Hospital Liaison Committee to develop a bloodless care plan. The implementation of the patient's care and treatment plan should be inclusive to their religious beliefs and preferences. With the evaluation, the nurse should regularly check to make sure that the patient's treatment preferences and religious beliefs are being upheld as it relates to their patient care.